Welcome to the Deep Dive, where we take a complicated stack of research, articles, scientific reviews, and really just try to give you the most important, most fascinating nuggets of knowledge.
Right, and today we're undertaking a deep dive into the dual identity of the world's most consumed psychoactive substance, caffeine.
And not just caffeine alone.
No, we're pairing that with its constant companion in, all those sports and energy drinks, taurine.
Okay.
And these two chemicals, they're simultaneously marketed as these, elixirs of focus and energy, yet our sources show they can be potent triggers for some really serious health risks.
That dual identity, that's really the heart of our mission today, isn't it? This chemical Jekyll and Hyde of your morning routine.
Exactly.
Because for a successful adult, caffeine is a tool, a cognitive friend. But our sources, which they span about 2 decades of specialized research, they force us to look critically at what happens when these things get packaged into these high-dose energy drinks.
And consumed by vulnerable populations.
Exactly.
Yeah, we're not just talking about a bad night's sleep here. We're dissecting the paradoxical nature of these ingredients across major body systems: neurological, cardiovascular health, metabolic function, even your skin.
So the goal is to connect the acute short-term benefits that you feel to the measurable chronic damage that shows up later on.
That's it, especially in children, adolescents, and chronic headache sufferers. This is really about understanding the cost of that rush.
Okay, so let's unpack the energy drink cocktail itself. It feels like they've been around forever, but the first one only debuted in Austria in, 1987?
That's right. It didn't even hit North America for about another decade.
So what are we actually talking about when we say energy drink?
We're talking about a non-alcoholic blend with extremely high concentrations of caffeine. Often, far exceeding a standard cup of coffee.
Right.
And that's combined with taurine, massive amounts of sugar or artificial sweeteners, vitamins, and then various botanicals like guarana and ginseng. It's a real shotgun approach to stimulus.
And the sources are very clear that this shotgun approach it's particularly dangerous for young people.
Yes, when their organs and systems are still developing.
So what's the first warning sign for, say, a child?
For children, even just acute consumption can be a problem, because their endocrine systems, the systems regulating hormones, are still developing. They're unstable.
So one can is enough to cause issues.
It can be, yeah. We see what are clinically called overnight breaks, which is just severe sleep disruption, also headaches, and noticeably dulled cognition the next day. That short-term boost really comes at a cost.
And the damage report, it just gets worse for adolescents who are drinking them regularly.
It does. That's where the systemic risk profile really starts to build. The list is extensive.
Like what?
Well, we see impact on the heart, high systolic blood pressure, heart palpitations. Psychologically, there's increased agitation, anxiety. Physically, poor sleep quality, osteoporosis risks, stomach ulcers.
So wait, if the ingredients are individually okay, and we know caffeine and taurine aren't new, why is the cocktail worse?
That's a crucial insight from the research. The effects on the cardiovascular system specifically could be worse because of the combination.
A synergy.
A kind of cardiovascular synergy, yeah. The sources suggest that. Alone, caffeine raises your heart rate, but combined, the effect on blood pressure and heart rhythm seems to be amplified. It creates this measurable systemic stress that we just don't see with caffeine alone.
And here's where the paradox gets really interesting, because if we isolate taurine, the often maligned additive, it actually looks like a powerful friend to the body.
Absolutely. Taurine prevents obesity in children. In adolescents, it shows significant positive effects on inflammation and oxidative stress.
Which is basically cellular damage.
Right, from free radicals.
Yeah.
It even helps shield students' skin from that damaging oxidative stress. It's clearly not a bad compound on its own.
And we can't forget caffeine's acute benefits. The sources do confirm that in moderation, it improves vigilance, attention, reaction time.
Oh, for a performance boost, it absolutely delivers in the short term. It delivers, yes, but chronic heavy intake is where the body shows these definitive signs of wear. The research highlights some really serious red flags for liver and kidney function.
Okay.
Chronic energy drink intake significantly increases serum levels of key biomarkers: uric acid, creatinine, BUN, ALT, and ALP.
Okay, for the listener who doesn't track their blood work every week, let's slow down and define what those acronyms mean.
Good idea. Think of those as the body's damage report card. BUN, or blood urea nitrogen, and creatinine are the primary indicators doctors look at to assess how well your kidneys are filtering waste. Elevated levels suggest those kidneys are struggling.
And ALT and ALP.
Similarly, those alanine aminotransferase and alkaline phosphatase are liver enzymes. When they're found at high levels in the blood, it usually means there's measurable injury to your liver cells.
So this is clinical proof.
It is.
Yeah.
It's clinical proof that heavy long-term use is corrosive. It moves way beyond a feeling of jitteriness to actual physiological damage.
That's a stark picture. So let's zoom in on where this chemical conflict is most obvious. The brain. Specifically, caffeine and headaches.
The ultimate frenemy.
It really is. It's simultaneously a recommended cure and a universally recognized trigger.
And it functions as an extraordinary analgesic adjuvant.
Meaning it makes painkillers work better.
Better and faster, yes. Caffeine is highly effective in acute migraine treatment, especially when it's combined with common over-the-counter analgesics like aspirin and acetaminophen.
And what's the evidence for that?
Well, one specific study showed that a standard dose, 130 milligrams of caffeine, combined with those analgesics, offered superior efficacy and speed compared to just taking ibuprofen alone for a severe migraine.
Interesting.
And it's also been found effective in low doses for treating acute migraines in children.
So how does it actually work? What is this methylxanthine compound doing in the brain to relieve pain?
It's all about blocking signals. Caffeine is primarily an adenosine receptor antagonist.
Mm-hmm.
Adenosine is a compound in your body that promotes sleepiness and pain signaling. During a migraine, adenosine levels in the plasma go up, and that correlates with pain.
I see.
So caffeine steps in, blocks those receptors, and it also inhibits another pain pathway called cyclooxygenase activity. It essentially reduces your perception of pain.
That makes perfect sense for acute relief. But if it blocks pain, how does the exact same chemical suddenly become the thing that causes the headache?
That's the core paradox. And it's tied to its vascular action.
The blood vessel.
The blood vessels. While caffeine might cause vasodilation or widening of blood vessels elsewhere, in the central nervous system, it's a powerful vasoconstrictor. It literally clamps down the blood vessels in your brain.
It tightens the plumbing.
Precisely. This action significantly raises your cerebrovascular resistance, or CVR, and reduces cerebral blood flow, CBF, globally. Studies show up to a 20% reduction in gray matter blood flow. And while this clamping down can relieve the pressure of a migraine, it also creates a state of dependency.
Dependency. So the headache trigger isn't the caffeine itself, it's the absence of it.
That is the withdrawal cycle. When you are a regular habitual consumer and you suddenly stop, those clamped blood vessels abruptly expand again. This rapid vasodilation is what's strongly associated with that notorious caffeine withdrawal headache.
And it feels different?
It does. It's typically bilateral, both sides of the head, and throbbing. And for habitual users, consuming at least 100 milligrams of caffeine will usually resolve that pain within an hour.
Which just proves the dependency mechanism perfectly.
It does.
So what you're saying is, for many people, they're drinking coffee in the morning, not for an energy boost, but just to return their brain to the physical state it was in the day before.
To cure a problem the habit created.
Wow.
And that's the painful reality. If you keep riding that cycle, using caffeine to relieve the symptoms it caused, you escalate the problem into a chronic condition.
So how does that acute relief turn into a long-term issue?
Overuse is a major risk factor for what's called migraine chronification.
And what's the definition of that?
That's when a person has headaches 15 days or more per month for over 3 months. If you're regularly using caffeine-containing pain relievers, you risk developing what are called medication overuse headaches.
Rebound headaches.
Rebound headaches.
Yeah.
You are functionally perpetuating the problem. It's a chemical debt cycle.
A debt cycle. I like that.
And there's more. We find that caffeine can induce headaches by decreasing magnesium levels. It causes you to lose more magnesium through urination. And since magnesium plays a really well-documented beneficial role in chronic pain.
You're depleting your own defenses.
Exactly. It's another way that caffeine, over time, sabotages your body's ability to manage its own pain.
Okay, so if the effects are this complex, it makes sense that our reaction to caffeine is not universal. It's really highly individualized.
It's like a genetic fingerprint. That's one of the most important takeaways.
Yeah.
The research shows our physical response, from alertness to anxiety, is genetically determined.
And there's a specific gene for that.
There is. The sources highlight a specific genetic variant, the ADORA2A RS5751876 SNP.
Okay, that sounds like a line from a chemistry textbook. We need the real-world translation there.
Huh, right. In simple terms, think of it as the jittery gene.
The jittery Joe.
This particular genetic variation is associated with a much greater susceptibility to feeling caffeine-induced anxiety. And what's critical is that this anxious response is most pronounced in people who are non- or low habitual consumers.
So if I have this gene and drink coffee every day, I might be okay. But if you have it and only drink coffee once a month, you're going to feel intensely wired and uncomfortable.
Exactly. Which leads us to the fascinating paradox of tolerance. With frequent consumption, you develop substantial tolerance to that anxiogenic effect, the jittery feeling.
Okay.
But here's the true kicker for chronic, heavy users. They often find that consuming caffeine merely returns their alertness to their pre-withdrawal baseline levels.
So they're not getting a boost.
They get no net benefit. They're spending money and energy simply to avoid feeling tired and irritable. They just reverse the withdrawal they created.
That realization alone should be enough for people to consider cutting back. For those heavy users, say over 300 milligrams a day, what does the withdrawal look like?
It can be severe. Heavy users and chronic migraine sufferers are at the highest risk. The hallmark symptom is, of course, the headache.
Of course.
But it's often accompanied by profound fatigue, irritability, difficulty concentrating, and even flu-like manifestations, nausea, muscle stiffness.
What's the timeline we're dealing with?
Onset is quick, usually within 12 to 24 hours. The symptoms peak when you feel the absolute worst between 20 and 51 hours.
But it ends.
Fortunately, yes, it's a finite experience. Most symptoms fully resolve within 2 to 9 days.
That short duration is good news. What's the safest way to avoid that acute misery? Because going cold turkey is clearly not the best route.
No, cold turkey is what triggers the worst rebound. The most effective method is gradual tapering.
Just slowly reduce.
Slowly reduce your daily intake by a controlled amount, no more than, say, 25% to 50% every few days. This lets your body neuroadapt gently and avoids that abrupt vascular shock that causes the throbbing.
Okay, before we wrap up, I want to pivot briefly to a surprising area where caffeine is actually a friend. The skin.
It seems entirely counterintuitive, doesn't it?
It does, given how much it messes with our sleep.
It is, but the research shows interesting topical and internal benefits. Ingested caffeine acts almost like an internal sunscreen. It's linked to preventing UVB-induced skin cancer.
Really?
Yes, and it helps protect skin cells from oxidative stress-induced senescence, which is cellular aging. We even found studies showing it contributed to faster skin healing in adolescents.
There has to be a massive caveat here. The best way to have healthy skin is restorative sleep, and caffeine is actively robbing us of that.
Precisely. This is the ultimate 2 steps forward, 1 step back scenario. Good sleep is crucial for skin health.
Okay.
When it's disrupted, you see dark circles, poor collagen repair, impaired barrier healing.
And the studies back that up.
They do. One showed that good sleepers had 30% better skin barrier healing than poor sleepers.
And linking it back to the energy drink cocktail, our sources point out a specific ratio that spells disaster for sleep.
That's right. The sources noted that having a low ratio of taurine to high caffeine significantly decreases overall sleep quality. So the chemicals might offer some protection, but the central nervous system disruption they cause via sleep loss, it often negates those benefits entirely.
Okay.
So what does this entire stack of sources mean for you? If we synthesize this whole paradox, the core takeaway is simple.
It is.
I think so. Caffeine isn't inherently good or bad. Its impact depends entirely on your consumption pattern and your unique, genetically determined body chemistry.
And for anyone who suffers from chronic headaches, what's the one critical, actionable insight?
Consistency is king. To prevent that withdrawal cycle that escalates into chronification, keep your daily intake stable. And ideally, keep your maximum daily consumption below 200 milligrams.
That's the threshold.
It's often cited as the safe threshold for minimizing dependency risk. Use it as a tool, not a dependency.
Okay, let's unpack this final, slightly provocative nugget, something for you to really mull over. The symptoms of caffeine withdrawal, that profound fatigue, the yawning, irritability, difficulty concentrating, they significantly overlap with the symptoms reported during the migraine prodromal phase.
And the 2 to 48 hours before the actual headache begins.
Exactly.
That overlap is fascinating. What if, for some people, the trigger isn't that they stop their morning coffee, but that the early stages of a migraine attack cause fatigue and irritability?
Which then leads to a compensatory caffeine craving.
Right.
That truly blurs the line between cause and effect, doesn't it?
Hmm.
Is your morning cup of coffee truly breaking your migraine cycle, or is it merely perpetuating a self-inflicted rebound that's masking a deeper biological rhythm?
That is the question.
And that's the question to consider until our next deep dive.